Evening, ladies and gentlemen, and welcome to tonight's talk held by TMC Fertility. I am Azian Majid, your host for this evening. Tonight is going to be a chilled night, so make sure you grab your tea, grab your coffee, get relaxed, grab your partners, because this topic is going to be very interesting. So, pregnancy can be a very beautiful thing. It is a new and different experience for in people's life. It's a new chapter, right? So partners tend to experience feelings about each other that they may not have thought they were able to experience before. So this can be like good, like can be bad. We shall see, right? So I mean, most of the time, while male partners try their very best to be supportive while for their female counterparts, there are times during a pregnancy when a woman really wish that men knew just a little bit more than what they already do. So, gentlemen, I hope you have your biscuits ready because we're about to spill some tea. And ladies, sit back, relax, and let us help your man understand you better. So tonight's topic, what women want men to know about pregnancy. So there you go. We can have a lot of fun with this topic. So for all of you who are watching now, don't forget to like and also share onto onto your own personal page because this topic a lot of people need to be listening to. So hi everybody in the comments. I would like you guys to say where you're coming from, where you're watching from, where you're coming from. I'm still in like MCO mode. I need to remember. Tell me where you're tuning in from. Hi, Alia. Hi, Sharon. It's nice for you guys to. Kota Damansara. Very close by. Wonderful. Okay, guys, so make sure you go and share that yeah, share it out to all your social medias, all your mummies groups, all your ladies groups, all your friends groups. Send it to your husbands as well if he's not already next to you. If he's in the living room, make sure he watches this. Okay, right. So the person that will be taking us through this journey of pregnancy is somebody that I really look up to, and I really trust with my life. Now, why do I say this? He is a fertility specialist, one of the best in his field. And me and my husband met him about 5.5 years ago. We were going through our own infertility journey, and he was actually the fifth doctor that we went to see. And honestly, we were sort of at like our rope's end. We were about to give up already. But the magic of this person is that the moment we walked in, the moment we met him, we loved him instantly. He was easy to talk to. He made us feel very comfortable. And most importantly, he made us feel very hopeful. So, my pregnancy journey was not without its own drama and complications, but Dr. Navdeep, I knew that I was in very good hands. Look at me now, 5 years later, I have two beautiful children, both delivered by the man himself. So, it is with my incredible honor to introduce to you our speaker for tonight, Dr. Navdeep Singh. Doctor, are you there?
Yes, I'm here. Thank you very
Hi.
much for that kind introduction.
It's
Well,
from the heart.
everything happened in the grace of God.
Yes.
We all of us were blessed.
I was definitely
Right.
very blessed. So it's nice to have you with us tonight, Doctor. Uh, tell us a little bit about what you want to share and why this topic came about.
Well, I'd like to share something with everyone regarding what men know, you know, and because during pregnancy and after delivery and all, men generally a bit on the other side of things. So, unlike women, I believe women have a program in them. The moment they deliver their babies, straight away the program gets downloaded in them and they know what to do. You do not need to tell the lady what to do, how to take care of the baby. Most of the time, they know what to do. It's amazing. Men, on the other hand, well, need to be told,
Need
you
a bit of
know,
help. Need a
need
bit
a
more
bit of help,
direction.
you know. So end of the day, after delivery, men has to just menurut perintah. You just yes, boss, listen and do what's needed. So I guess this talk is for the benefit of the men too. Okay, so at least they know what to do.
All right, I'm gonna give the floor to you.
All right, so I'll share my slides now. Share screen. Okay,
Yeah,
Coming on.
there we
All
go.
right. My topic today is what women want men to know about pregnancy. Okay, so I'm Dr. Navdeep from TMC Fertility, Puchong. Somehow it doesn't want the slides don't want to change. Let's share again. Share.
Of course, this is something that happens all the time during a live event. What needs to trust me, guys? We had a dry run before everything was working perfectly.
Uh,
How's it looking now?
Okay. Right.
There we
Yes.
go.
Perfect. Okay. So as I said, my topic is about what women want men to know about pregnancy. So I'll go through the whole process, the first trimester, second trimester, third trimester, and post delivery. Okay, so a bit about us, TMC Fertility. We are basically a fertility center. We take care also of patients with gynae problems and pregnancy-related issues. We have our IVF labs in all our centers, and in various in Malaysia. For example, we have one in Ipoh, Penang, Johor, and three in Klang Valley. This is Puchong, Kapong, and Kota Damansara. So we generally do what's called the assisted reproductive procedures like IVF, also known as test tube babies, intra inseminations, and genetic testing. Genetic testing basically known as pre-implantation genetic testing, where we can determine the best embryo for transfer. Okay, so that's about what basically we do. Now, coming to the main topic today. So I'd like to start with basics. Well, first trimester is the most important part, where it is the first 3 months during pregnancy, and you should take care of yourself very strictly. Okay. The second trimester is between 14 to 28 weeks. Third trimester is 28 to 40. Subsequently, we talk about labor and after delivery. Right. Coming to the first trimester. Now, during this time, there's a lot of issues in, for example, morning sickness, there are mood swings, heartburn, lots of like metallic taste and food aversions. Okay, so men, regarding the mood swings, it's not your wife who has the problem; it's the hormones which causing the problem. So don't blame her. Okay, and they might get things like headaches, which is quite common also during pregnancy. I've also been having a lot of questions about weight gain. Weight gain in pregnancy is about 11 but 17 kg. Okay, it all depends on how much of weight, how heavy were you when you start before you started the pregnancy. Okay, so on the average, you'll be 11 to 17. It's still all right. So, and regarding weight loss, okay, first trimester, many women tend to lose weight. Okay, because they have no appetite, nausea, vomiting, the gassiness. So it's very common. Nothing to worry, because subsequently, as the pregnancy goes on, you will eventually put on quite a lot of weight. Okay, so regarding the first trimester, you should know the dangerous symptoms or okay, for example, bleeding, abdominal. Okay, when you painful, this may indicate urinary tract infections. Okay, fever, chills, backache. When you have all the symptoms, it's best to go and see the doctor. And please don't Google. Lots of my patients will end up Googling it, say, doctor, I think I have a growth in my kidney. I say, why? Oh, because I have pain over that area and I Googled it. It was actually, it states that I may have a growth in my kidney. I'm like, oh no, please don't Google. Okay, and it was just I think that patient had just a muscle pull. Okay, so what need to do first trimester? Take your vitamin, and the most important vitamin is folic acid. And that reduces your risk of getting a risk of neural tube defects, which is basically a brain, skull, spine problem among the growing babies. Okay, and you have to choose your doctor. Always choose a doctor which is you are easy to access, which is a hospital closer to your house. Okay, so in case of emergency, it's easy for you to go there, and hospital with all the facilities available. So that's the best kind of thing we should look for. And take time to consider the options because nowadays with Google around, there are many is it
Doctor? Uh,
is the intent okay?
yeah, I think you paused for a little bit. So you stopped at now with Google, there are many ways. I think you're going to go with finding the best practitioner.
Okay, fine. I thought the line was cut a little bit.
Yeah, it was
Something.
just slightly.
Okay. So basically, we're talking about take time to consider your options and pick the right doctor for your needs. As I mentioned, make sure somebody who is nearer to your area. So at the first visit, what the doctor will do, we'll take a medical history from you. We'll look at any risk factors, previous illnesses or surgery. For example, illnesses like diabetes, hypertension, or like surgery to your womb, like fibroid removal. All these things will determine the success or progress of your pregnancy. Okay, so we'll do a physical examination, check your lungs, and then do blood tests. Blood tests like for infection, blood type. Okay, and once everything's all right, then nothing to worry. And we also do the ultrasound scan where we'll determine the due date. And it's when you do the ultrasound, I'll suggest you, doctor allows you to, you can record it because it'd be a very nice thing to keep for your future. Okay. And the other things that we do will be that we will look at the genetic illnesses. Okay, where we can do some blood tests, we can determine whether your baby is healthy or not. Okay, and always yes, prepare your own questions because lots of times patients coming in a booklet, all the questions written down, and I think it's a good thing because there's I believe there's no such thing as a stupid question. Okay, because if you miss something out, then it might affect you. So it's always better to ask your questions. Okay, so other things include as I mentioned, genetic testing, where we take your blood, okay, and look for baby cells, and that ways we can determine whether or not the baby has any genetic abnormality or not. Example, Down syndrome, Edward Papal, and you also know the gender at the earlier phase of the pregnancy. Okay, you also can eat right, make sure you have time for fitness. The best exercise would be brisk walking. If you can, swimming. But now all the pools are closed because of MCO. So brisk walking is thing, or even with stationary bicycles. Okay, you can look into health insurance, and it's very important thing is to make a budget. Okay, and so I get lots of questions from patients regarding sex. Yes, sex is safe, but not aggressive sex. Okay, and if the wife complains of pain or some bleeding, please stop. All right.
Yeah.
Okay. So men, help her feel better. What can you do at that time? Okay, she'll be tired. She'll be going through quite a rough patch. So you can get her a medication and be supportive. Do a bit of a chores. in house. I wash the plates, even cook a meal.
Foot
And
massage,
huh?
foot massage.
Foot massage, yes. And because end of the day, you must understand your 50%, you 50% contributed to the pregnancy. You see, understand?
Exactly.
So, yes, another thing. If she's craving for food, even at 2 a.m., get up and get it.
Oh,
Because you have to be nice to her. Okay, right. And if she doesn't like certain
question.
things, you
I have a
can just
question.
avoid it. Yes, please.
Um, Earlier you said the first visit, right? So how long from when you get your pregnancy a positive pregnancy test at home before you go and see your doctor?
Well, I would recommend that you see a doctor as soon as you get a positive test.
Okay.
Okay, because sometimes some women have certain risk factors which a doctor can you know can detect early, sure that the pregnancy goes on smoothly.
Mm,
Lots of times patients come in a bit later, so and that time then they have hypertension, diabetes,
yeah,
which were not diagnosed. So it's better to see as early as possible.
right. So basically, the moment you get your positive, go book an appointment.
Yes, but I think that's the best thing to do.
Yeah, safest lah.
Yes, the safety first, because must understand, healthy mother equals to healthy baby.
Baby.
So other thing is that for men, as I said, that women have the program in them. So the moment baby is delivered, they know what to do. Men, we have to learn. And I said, no, we. I had to go through the same thing too. So I had to basically learn what to do. We learn books, look at, nowadays you have YouTube,
Mm,
and also accompany her for appointments. Because during the appointments, as the doctor speaks and gives advice, at least you'll be in the know of what's going on.
yeah.
So you'll know that if something happens, what to do. So that's the important aspect. You should accompany your wife on appointments,
Mm,
right? And also attend prenatal classes together, because during the labor process, lots of things will happen. She might forget certain things, she'll be in pain. So you can remind her, hey, remember what we learned the other day? Take a deep breath, and look at things more positively. So you should can hold a hand and go through it with her. And women, you can squeeze your husband's hand as hard as you want.
and the husband's not allowed to complain at this stage.
Oh yes, you know. So that was about the first trimester. And
Maybe
any question?
before we head into the second, before we head on to the second trimester, I see a lot of people in the comments tagging men's name. I'm guessing you guys are tagging your husband. Good work, ladies. Usually, the ones who will be tuning in are always the women because women are, especially like you say, whenever they're going through pregnancy, we are the ones who are in the what to know. You know, but we have to want to see drag also. No, we have to coax our guys to come along. We have to coax our guys to come along. Actually, has got a good question here. At what stage should we start going for prenatal classes?
Well, there are many programs available for these classes and these courses and all. So it all depends on which and when, which kind of course or when you want to attend. Usually, it will be the third trimester, like when you're uh, closer to delivery. So that's when you will remember, you retain certain information. So you start going too early in the first trimester, and by the time you go deliver, you had forgotten the information.
Do you know when I went though, doctor? I went on I think my 20th week.
Ah,
I went early. I went early because I didn't want to be uncomfortable when I sat through the prenatal classes. I did, like there's also something else I thought I was considering. I didn't want to be sitting down too long. When I'm big and heavy and super uncomfortable, that's when I, I went at 20 weeks, which a lot of, like you say, a lot of people who were at the class were like already in their third trimester.
so then you
So
remember what
right
you
or
learned.
wrong. Yeah.
Okay, is there
Okay,
any
so
questions for the
to
first trimester?
sorry, did I retain? I think so.
Yeah,
I went with my no, but most of the time when parents, especially new moms, when they go, they will like want to get everything down. We write everything down. So that was me. I was one of them. Okay, just to recap what you said, it is, ladies and gentlemen, very important. It is not your wife. It is the hormones. Be
hormone.
nice. Be nice to her. It's not your wife, it's the hormones. And that's the other thing that happened to me in the first trimester was that my sense of smell increased like crazy. My husband called me Wolverine. He called me Wolverine.
I had a patient whose husband bought her a brand new BMW, and she couldn't stand that smell of the new leather. So, needless to say, the husband was quite happy that he could use the new car.
We have a few good questions here. So we'll take two more questions before we head on to the second
Yes,
trimester.
yes,
First one's
please.
from Mel. Can we drink coffee when we are pregnant?
Okay, that's a quite a common question that we generally face. Coffee is safe during pregnancy. Whatever you do, you should do it in moderation. If you overdo something, then you get gastritis. You will get with more frequency in passing motion. So that's the reason why you should control the coffee.
Yeah.
But overall, 1 or 2 cups a day will not harm at all.
So it's perfectly fine as long as we do it in moderation. Last
Yeah.
question before we go ahead. What can we learn from? So what do you expect to learn from prenatal classes? Why are they important?
Well, prenatal classes, you learn about the whole delivery process of how to take care of yourself and the breathing exercises. The other things would be the medication that the doctors will eventually will give you. You'll be more aware what's so knowledge is so as long as you are aware, then you'll be comfortable. So I definitely recommend my patients to go for all these prenatal classes.
Right. Thank you so much. I think we're ready to head on to the next trimester. Second trimester. Jang jang jang.
Okay, now this is the most comfortable part of the 3 trimesters. Okay, and this is basically regarded as the honeymoon time. So if anybody wants to go and go travel during this time, of course now tak boleh lah because of MCO. But otherwise, you can do more things. You can be more mobile. You can walk around more. Okay, and this is a time when your baby starts to grow and you can generally feel a bit of the movements and all. So things that happens will be like certain symptoms will persist. Yes, be like heartburn, constipation. So constipation and all is all due to the hormones. Okay, and heartburn. The easiest way to treat it is take some, antacids kind of syrups, which is very very safe. And at this time, you'll see your tummy growing. You can actually see the bulge, and it's as the hormone goes higher and higher, all your symptoms too will start to
Intensify.
worsen a little bit, amplify slightly. Right, changes in your body, like congestion. When you talk about congestion, it's like be like your nose, your throat, okay, will be all like swollen a bit. So that's why during a pregnancy, you tend to snore. Okay,
Yeah, I
so
did. I snore
yes,
so badly.
so it's only temporary. So men, you find that disturbing, well, do not wake her up. Let her sleep. You can just put some earbuds if you want to, and they'll get mild swelling, sensitivity, gums, leg cramps. Leg cramps basically on your lower your calves. Okay, you only need to do some form of exercise, and you should be fine. Varicose veins, hemorrhoids, all these aches here and aches there, which is very common. So, danger symptoms will be like bleeding, severe abdominal pain, fever, sudden excessive weight gain, or even swelling of your face, hands, vision changes. All these may lead to like things like what preeclampsia. Okay, and that's when the doctor will check your blood pressure to confirm diagnosis. During pregnancy too, it's a state of water retention. So your rings and all will be very tight. So it's always better to remove the rings and store them. Okay. And after delivery, you can put all your jewelry on again. So till then, so do's and don'ts. Eat well again. Exercise, brisk walking is fantastic. Okay, if you want to do some yoga and all, this is the best time to do that. Get immunized. There are a few types of vaccinations which you should get. Things like for flu, Tdap is for the tetanus, diphtheria, and pertussis. You should take that too. And of course, now with we're having the COVID season, so everybody should get the vaccine.
Yeah.
There are a lot of scare about the vaccines. So I'll ask the patients, what are you actually scared about? Are you scared about the vaccine, disease? So, so I said the disease is really scary. Vaccine is not. Vaccine is going to protect you. Okay, so after 12 weeks, please get the vaccine. Okay, and it's perfectly safe. So, yeah, there are a lot of reports about some adverse effects and all, but they are far and few. So, most women get protected. So, you won't get a severe disease.
Yeah.
Okay,
Right. I've
I
got a
think there's
question about eating because one of it says to eat well, right? So how do you eat? Are you eating to reduce your blood sugar level? How, yeah, do you, so how, what's the best way to eat? Eat well is so wide. Do you, obviously not fast because we're pregnant. So,
so when you talk about eating, yeah, eat small meals but regularly. You can have your breakfast, brunch, lunch, tea, dinner, supper. You can eat nicely, okay? But small amount more regularly because then you won't have the spikes of sugar levels and drops of sugar. A spike and the dropping the sugar levels, which is not very good. So the other thing about your meals, increase the vegetables, fruits. You can take meat, and it must be well done, cooked properly. Nothing. Your meat shouldn't be raw. Okay, and things that if you are diabetic, reduce the rice, like what we say, quarter, quarter, half, suku suku separuh. Okay, so the rice should be quarter, your vegetables should be half, the meat can be quarter too. Okay,
right.
and things like even this prenatal milk products. Okay, some of them contain a lot of calories. So don't put too much of scoops into your water, your drink, and drink it. Okay, because then your sugar may increase too.
Right.
So whatever you do in moderation.
What about prenatal supplements? Supplements
Yes, of
during
course.
pregnancy.
Supplements are important because some women are iron deficiency. They have iron deficiency where they are anemic. Okay, so they should take some form of vitamins, multivitamin pills with iron in there, with some calcium. That's good enough.
And I have one more. When does morning sickness start and when does it end? How come some women just don't get it?
Well, their luck. Some women they have 10 pregnancies, and one is very bad, the next one is very mild, third one don't have symptoms. I got some patients who don't have symptoms and they'll be upset. No, I
Yeah.
said, why my friend is vomiting away and I'm not? Don't worry, it's your luck. Probably your next pregnancy you might vomit more.
Oh gosh.
Okay. Generally it starts about like 8 weeks, sometimes earlier 6 weeks, okay, and can go up to about 14 to 16 weeks. But generally are about 10 to about 12 weeks. That will be the peak. Okay. And during the when you have this morning sickness, small meals but more regularly. Okay. And I got one patient who only ate twisties during the first trimester because she couldn't tolerate anything else.
Anything
But we
else?
all know it's unhealthy, but that's the only thing she could take.
Right.
you know, some of them even drink Ribena. Okay, that's all they can take. So
I was quite weird. I would only take the white Vitagen. I never liked the white Vitagen, but I was craving. I couldn't drink water. My husband had to really like force me to drink water. But white Vitagen was the one I was craving a lot. It was weird.
yeah, so that's another advice for men to never force your wife to eat something or drink something. Let them go with their feeling, their cravings. Okay, because most importantly, you do not want your wife to be uncomfortable.
Yeah.
I got some patients, first timers, they'll buy a whole bag load of vitamins and minerals and all. Every time they eat it, they'll puke it all out.
Oh.
So yeah, so don't overdo anything.
Yeah. Okay, this is one good question. I think this is the last question before we will go ahead, okay? Because
Okay.
in the market, there's a lot of people who are talking about goat's milk that's really good for pregnant women. So, what are your thoughts on that? Because there's a lot of them in the market, and some are they're not fully approved. Some drink fresh goat's milk there, so they're not pasteurized. So,
Well,
thoughts, doctor?
in my opinion, buy the milk products which are from off the shelf in the supermarket. Don't buy things which are fresh from the farm, non-pasteurized, not clean, because then you're exposing yourself to certain type of diseases. Okay, so products that are pasteurized and clean, they are safe for us to use. So that's my number one advice would be. Second thing about goat's milk. Well, you can drink it. That's not a problem. Okay, I'm quite sure goat's milk to be as good as cow's milk, but you do not need to unnecessarily invest, and spend some extra money on certain types of special products just because you're pregnant. You can take the normal products. So the cow's milk, which is available in the supermarket, good enough. Of course, if you like drinking goat's milk, go ahead. That's not a problem.
That they should be pasteurized?
Yes, must be pasteurized.
Okay. All
And
right.
that's why, I mean, usually you get them in the supermarkets, so
Yeah.
they're perfectly clean.
Okay.
Yeah.
Yep.
Any other questions?
If I keep asking, getting into the questions, I'm not sure we'll get through the slide. Okay, but these are okay. So
Okay.
one comment, which is good. My second trimester is fully laying on my bed thanks to Dr. Navdeep's advice.
Sorry, I can't hear you.
Can you hear me now? Hello.
The line seemed to have I can't seem to hear you.
Can you hear me?
Yes, now I can hear you. Yes.
Okay, cool. All right. So we have from Amanda. If I'm vegetarian but my blood is low during pregnancy, should I start eating meat?
Not necessary if you're vegetarian for religious reasons or your own preference. Do not need to start eating meat. Just just take multivitamins with higher iron content.
Yeah.
That's necessary. That's all you need to do.
All right. Good. Thank you so much, Doctor. I think we can go ahead. Otherwise, we're going to end this at like 11 o'clock at night.
Okay.
But good questions. Good questions from the audience, guys. Thank
No
you so
problem.
much.
Okay, so the next part will be the second trimester to do. When you go and see a doctor, they will do the routine checks for you, like your weight, your urine, your blood test. Okay, and other things would be like your sugar to rule out diabetes. You do something called the modified glucose tolerance test, where we make you fast and make you check the fasting blood sugar, and then we give you some sugar water to drink. Then 2 hours later, we'll check your sugars again. So this is to ensure that you don't have diabetes. And if you have it, then we'll advise you regarding the dietary plan, medication if necessary. Then at the same time, you'll do an ultrasound scan to ensure your baby is progressing well. We also do things called the fetal anomaly scan, also known as the detailed scan. This scan we look for any anomalies, any physical abnormalities in your baby, which can be treated if in certain time can be treated, or in certain situations where we detect a problem, then we advise you where to deliver, and places where they have treatment options for those types of problems. But those are very rare, so most of the time babies be nice and fine, normal. All right, so men, pamper her. So I mentioned to you this honeymoon phase of pregnancy after the first trimester sickness, before the third trimester problems. Okay, so if you want to go for a holiday, you can help her plan with a friends for a baby shower. Go ahead, this is the best time. He won't puke this time.
Yeah.
Okay, so that's about the second trimester. That's the easiest part.
That's the easiest part.
Any questions about second trimester?
I think we are good. A lot of them were asking the questions already answered. So, I mean, second trimester for myself was it was when the morning sickness, or I didn't feel so bad. I actually felt like I had the most energy. My skin was glowing, so I felt like I could go here and there and do a lot of things I wasn't supposed to. Dr. Navdeep knows. He tells me to not move so much, but you feel you can do everything. This is where nesting happens. You feel like you want to do the nursery, you want to get the crib, you want to do all these things, but please follow the advice of your doctor to avoid any
It's
complications.
all depends on certain medical illnesses that you have, certain risk factors. Then the doctor will advise you the do's and don'ts.
Amanda's asking, when do you do that fetal anomaly scan? So this during the end of the second
So your
trimester,
your
or
line your line broke up again.
my line? Are you able to hear me now?
Yes, can, yes.
Amanda asks, when is the best time during the second trimester to do the scan, the fetal anomaly scan?
Fetal anomaly scans are generally done between the 18th week till the 24th week of the pregnancy.
Okay. Okay.
And
So
sometimes
anytime from
we
there.
do it a bit later, around 24 weeks. That's when we can assess the heart and parts of the baby more with more clarity.
Okay. So towards the 24th week will be the best.
Yeah.
I remember Dr. Nati telling me do it because I wanted to do it earlier. Of course, everybody wants to do it earlier to see the baby, but I remember what you said to me is just be patient, wait a couple more weeks, do it towards the end when they're nice and filled, so they don't look so sunken. They've got their cheeks and everything, and I think it was good advice. It's good advice.
As the later part of pregnancies, you see a much nicer looking baby.
Yeah.
The earlier part, all skeletons and bones. Yeah, so it's scary looking.
It's very looking. Okay, I think we can proceed, Doctor.
Okay, so third trimester, this is when your belly tends to grow bigger and bigger. Some women will say, Doctor, I don't think my belly can go any bigger than this. I said, no, it'll grow even bigger. Okay, so certain changes, feel a bit lots of fetal movements. I got some patients who have to put pillows everywhere. They have 10 pillows around them, yet they feel uncomfortable. That's very, very common because as your body accommodates the growth of your baby, a lot of ligaments will be stretched and a lot of muscle pain here and there. You also get things like Braxton Hicks contractions, a bit of contractions here and there, a bit of hardening, and so that will be a bit uncomfortable for some women. And you feel tired, you have difficulty in sleeping because the baby be kicking time when you want to sleep, baby be kicking. So they can't. Things like heartburn, all these stretch marks, backaches, all will start. So it's
I have a
important to
question
wear
about stretch
proper
marks.
shoes.
Yes, proper shoes. Proper shoes. So not wedges. Just make sure they're flat and they have good support. about two things you mentioned just now. Braxton Hicks. So towards the now we're in the third trimester. So towards this will happen throughout. It can start and all the way up to the end of delivery. How do you differentiate Braxton Hicks and actual contractions?
Right. Braxton Hicks, it's generally mild contractions, which is irregular, not painful. There's no rhythm to it. Unlike labor pains, there's rhythm to it. Okay, it increases intensity, frequency, and becomes more and more painful. Yeah. So when you have that, that's when you should take a slow drive to the hospital. So don't follow the movies, to break traffic lights, the traffic rules. You have to have like Fast and Furious. No, because
Not needed.
labor takes time. Okay,
Yeah.
so it's most important. Don't collect summons.
Don't collect summons, yes. And I think you mentioned something about stretch marks, which I think triggered a lot of people asking the question right now. What tips do you have to reduce stretch marks? I know the answer for this is genetics, but let's see what the doctor has to say.
Well, you can use anything you want. You can use cocoa butter, some moisturizers. Okay, but let's understand this. Stretch marks are norm. It's common. Um, one blog even mentioned that she said her stretch marks my baby's first drawing.
Yeah,
Okay,
that's
and
a beautiful way
yeah,
to put it.
so I always tell my patients, well, those with stretch marks are the luckiest people around because that means you have
Oh,
children. Okay, so don't fret so much about stretch marks. Okay,
guys,
it's
do you now see why I felt so comfortable with Dr. Navdeep? I mean, telling you, those with stretch marks is the luckiest ones. Is your baby first drawing? It's just a matter of perspective, I think. I mean, to me, there are women out there who are waiting so long to get pregnant. Embrace those stretch marks. My stretch marks, the one Ethan, my firstborn, gave me, looks like a phoenix. Like it just kind of goes out like that, and it's so cool. So have a look at your stretch mark, love your stretch marks, and then maybe describe in the comments what you think your stretch mark looks like. Maybe it looks, you look at clouds, you see unicorns. What do you see when you see your stretch marks?
stretch marks. Yeah,
Embrace.
probably it's a good way too. Yeah, good way to put
Yeah.
it. Mm. The other thing about stretch marks can become very itchy. So
Mm.
please don't scratch with your fingernails because by the time have you I mean the time to deliver, your tummy look like a tiger, all the tiger stripes. So don't scratch your fingernails, but you can rub it, rub your tummy over your clothing and all to reduce the itchiness. Okay, because whenever you scratch, you create small wound over the over your skin, and that will be even more itchy.
Mm-hmm.
So try your best not to stretch.
Yeah. Okay, last question before we move on. Yeah. This is from Mel. What situation will warrant an emergency C section?
All right. Emergency section will generally be poor progress of labor, where in spite of being labor for hours and you don't progress, and or fetal distress, if the baby's heartbeat drops to a certain level or persists at the low, what you call bradycardia, where it's very slow, that indicates distress, or the baby pass motion, you have the amniotic fluid, which is supposed to be whitish or clear, and that becomes like greenish. Then and you're very and more so if you're in the early part of your labor, then you need a cesarean section. The other thing would be breech babies or transverse line. Then sometimes what we doctors do, we'll turn them around. But if it's not successful or you have a contraindication to do that, then do a section.
Mm.
I always believe that women should try normal delivery first. If you fail, then okay, then go ahead and do cesarean section.
There
And
is no shame in a C section. I need to put that
sorry.
out. There's no shame in a C section. Sometimes women, especially these days, we are exposed so much to social pressure, that they say, whatever you do, don't let people take away that natural birth. And it's good that you have that intention, but then don't fight it when your doctor tells you that it's safer for you and your baby to go for C-section. I had plans for my baby, but
Mm.
both of them had to go for emergency C-section, and both of them were preemies. You know this, doc. You were the one who told me that you had to get them out, and I'm very
Yeah,
grateful that you did, because I don't think my babies would have survived otherwise. So
because
listen to your
end of the
body.
day, what do we all want? We want a healthy mother and want a healthy baby.
That's right.
The rest of the things does not. After a while, the rest of the things do not matter. When you go down the line 5 years, 10 years later, and you see your baby having a certain problem because of the something happened during the delivery, then you have some form of regret in you. So when there's a indication, well, I mean, most of the time you can see it yourself. That the doctor, the nurse is checking, and your cervix not opening, or you see the water bags greenish in color, or the fetal monitoring, shows a very abnormal CTG pattern. Then you know for sure. Look, better get baby out. End of the day, we doctors don't want trouble too, because when you have a baby with problems, or mother who's injured or has a certain problem, and then there's a lot of issues that we have to face. So always safety first. That's all. That's my advice.
Thank you so much, doctor.
Hmm. So coming back, any other questions before you continue?
I think we can continue first, and then we'll get to the questions
Yeah,
later.
okay. The questions will be coming in more and more. All
Yeah.
right. Symptoms that you have to get checked will be, uh, I mentioned the labor contractions, even water breaking. Okay, that's you're going to feel lots of water coming out. So that's things that you need to go. In those time, you have to see the doctor, especially also if now bleeding, fever, severe abdominal pain, and signs of preterm labor. That means if you have contractions even before the 37th week, then a doctor may have to give you medication to stop the contractions. But most of the time, see, as I mentioned, women have a certain program in them, okay, and they have certain thoughts, instincts, their instincts, which they know best about what's happening. So it's always better to trust your instincts. Okay, you feel there's a problem, you feel an issue, just drop by in doctor's clinic, get it checked. Okay, because there's never a time when you're just being careful. So it will definitely give you a sense of a peace of mind if you know that everything is fine.
Yeah.
Okay, the other thing would be to monitor your baby's movements. Watch your weight, eat small meals but more regularly. Keep moving, like brisk walking around your area. And the doctor may see you more frequently, usually be fortnightly, then be a weekly. So they also may check your cervix for things like group B, this kind of infection, okay, blood tests, all that will be done. And this is the best time to take a tour of your hospital and also choose a pediatrician. Because if you're familiar with the environment, then it'll be comfortable at that time. And
Yeah.
then also you know where to go in times of emergency, because you wouldn't be in having cramps, pain, and you don't know what to do. So plan the whole journey out. Prepare your bag too. Prepare the baby stuff in the bag. So and then put it the place where your husband knows where to find it. You know. So I got some
Also,
patients,
pack
the
your
husband and
husband's
wife like,
bag.
where's the things? I don't know.
Yes. It's sometimes as women have to do this. It's not just pack our own bags. It's our bags will consist of what we need, what the baby needs, but also pack your husband's bag. Because you're not mengharapkan your husband to do it, never
Yeah.
mind. And then he's gonna ask you while you are in labor, where is this and where is that? So never mind, just pack all the bags, put it
Yes.
in the car, put it somewhere where
Yes.
he can see it.
It, and then you won't have a problem searching for things, because when the
Exactly.
time comes, you'll be in pain, and every man will be like, okay, what you do now? So it's always
Yes.
prepare in advance.
Yeah.
Okay. And also, yes, if you can, lactation consultant, because breastfeeding is it's a good thing. Okay, so if you breastfeed your baby as long as possible, you'll be great. All right. The other things would be regarding birth plan. If you have a birth plan, so it's always good to discuss with, and so the doctor will go through it to make sure there's nothing dangerous, dangerous practices some people have. They read through the internet and then they want to do certain things, which is at times not recommended.
Yeah.
Okay, and the other thing about pain, man, a lot of people they have they don't like pain management in the labor process. How they want to feel pain. You can if you want to, but some people also get influenced by certain people who bad things about the epidural. Sort of myth surrounding epidural. They claim that you get chronic lower back pain. You take epidural, then you won't be able to push. You won't. Then the doctor not doing a cesarean section for that. So it's not true because evidence has shown that if a woman takes epidural, okay, and they have monitored these women over the years, they found that the number of back pain among women who have taken epidural and women who did not take epidural is the same. So what's the main cause of back pain in women after delivery? Number one, weight,
Carrying the baby.
because a lot of them put on a lot of weight after delivery. And after that, high heel shoes. Yes. Okay. And also posture. So how they breastfeed the baby, how they sit in the office, how they do their computer work, all these things will contribute to a lower back pain, not the epidural.
Yep.
Epidural is just to make you feel comfortable during a delivery process.
Let's
You
not
know.
forget that the mothers are usually the ones who are carrying the baby the majority of the time.
Mm.
So that contributes to back issues as well.
Right. Yes. So it's the posture. That's the type
Yes.
of the posture. But moment you deliver, after a few weeks later, it gets better. Yeah. There are things with like men. Yes. Make her feel comfortable. Massage her because she feel lots of aches and pains everywhere. Make dinner for her. Well, nowadays you can call the Grab or Food Panda.
Yes.
Fantastic. You don't have to cook, just get it. And time to delivery the labor process. You should prepare yourself in terms of do's and don'ts, what needs to be done, and recollect what you learned from the prenatal classes. Okay, and just hold the hand and just be next. Okay, she will tell you to do certain things, just go and get it for her. Okay, and right. So once the baby is out, it's post delivery time.
I have a
Okay,
question before we go post delivery.
ask
I
me
think
please.
somebody was asking, what's the pain like?
Pain, like, well, it's I there's a lot of description about the pain. You can see in the internet and the Google and all, but generally labor is very painful. So there's lots of ways for you to reduce your pain. Number one is the breathing exercises that you learn during your prenatal classes. Change your mindset. Try to have some bit of positive thinking. Okay, the other one would be like Anthanox gas. Okay, it's something like laughing gas. It can make you a bit drowsy. Then you have things like pethidine injections, reduce the pain. The best, as I mentioned, is epidural. But how to describe the pain? Is your question. You asked. It's basically, I would say it's just very painful, lah.
Most moms will tell you that it's like none other. It's just like how women would not be able to understand what it feels like to be kicked there. It,
Yeah.
it's just there is none other,
Not
none like it. There is none like it.
I am quite sure it's more painful than when the man gets kicked. It's not as painful as labor is more painful. What I mean to say,
Yeah, yeah.
labor is
Later is more
definitely more
painful.
painful.
Yeah. But you know what, like you see women having multiple children. So yes, it's painful, but then after that you get you start missing, being in. I remember because I have like some complications. I think that my last baby was my last one. So going through that, I just kind of you have this thing that you want to do it again, and you forget everything that you went through during pregnancy and delivery.
Yes. Well, you must understand not all pregnancies are the same.
Yep.
Complications or problems are like small speed bumps, you know. So you manage it.
Yeah. Yes, that's right. So post delivery.
Post delivery. So after birth, the husbands, you have to be like the gatekeeper. You have to ensure that the wife has, enough time for herself, enough rest, and just make sure she doesn't get disturbed too much by many people coming to visit. Okay, so it's going to be a very tiring time for everyone, especially everyone's trying their best to get used to the new baby around and take and help her out at times of feeding and changing the diapers. Okay, so your Saturday nights will be non-existent. Okay, no more partying with friends, no more going out. You're going to be staying at home and helping like a good husband. All right, of course, don't forget to have time for yourself too. If you're one of those who like to go to gym and all, go ahead, work out a little, okay, and take care of yourself too because it's very very important, and it's definitely something which is nerve wracking, but but end of the day, it's a very fulfilling thing to raise your child, raise a baby.
Yeah.
Now coming to another big topic, okay, regarding post delivery. Okay, it's something called postpartum depression. Okay, a lot of women undergo things called postpartum blues or baby blues. Okay, where they have mood swings, they have crying spells, they feel happy suddenly, they feel like crying. And men, she's not crying because of what you did or what you didn't do. It's all because the hormones. Okay, just stand there, don't say anything, just support her, give her a pat on the back. Okay, give her what she wants, and that's all. Basically, menurut perintah, whatever she wants to you do, just quietly do it. Okay, so it may last for a few days to a couple of weeks, but sometimes some women have very bad ones, which we term as postpartum depression or even psychosis. Okay, so it's not a weakness or something wrong with the wife, but it's basically a complication after delivery. It's mainly related to the hormones, and over the years it seems to be rising. Okay, but unfortunately, it's not very well understood by general public. Okay, things like as I mentioned, mood swings, anxiety, feel sad, irritable, be crying. Okay, and they're unable to sleep. All these things are very common during the first few days to weeks after delivery. But if it persists, like they feel depressed, they excessive crying, they don't want to see their baby, they want to be away from everyone, they're unable to sleep, okay, they have totally, like sense of hopelessness. Yes, then it's time that you need to see a doctor.
Yeah.
Things The next thing will be like psychosis. At times some women even harm themselves or even
Yes.
harm the baby. When that happens, then you need to bring her to the hospital. A psychiatrist needs to see her, and then you need to get some treatment.
Yeah.
Okay, and it will eventually subside. Okay, so
I
as I
would like
mentioned,
to
if it
add
gets worse, you see a doctor.
just to add to that, right, doctor, and also for the benefit of everybody here, it is incredibly important to be able to identify the signs of postpartum depression. It's not talked about enough, like doctors say. Sometimes our people outside don't really understand, and they just say, "Why is she being dramatic? Why is she doing this?" So, since this session is here for the husbands, watch out for these signs because she may not know what she's going through, but if you can see it, definitely seek professional help. I went through it and I didn't go through the one that's just baby blues. There's a difference between baby blues and postpartum depression. And I was given medication for it, and it made me a better mother because I remember feeling I know what I'm not supposed to do, but the my body and my mind were fighting, trying to do different things. I wanted to make the baby stop crying, whatever means, and but my mind was telling me different things. So when you get to that point, it is so important. Please get professional help. There is no shame in it because it's like doctors say, it is not the mother, it is a chemical imbalance in the body that happens. And it can happen anywhere between right after birth to 1 year after birth, anytime.
At any time, yes, can persist even longer than that. All the hormones.
It's all hormone, but get her help.
Yes, you
She
need
made you
help.
your child, get her help.
Mhm. Correct. Yes, and the numbers seem to be rising now in this country, even throughout the world. So, but unfortunately, not many people can what do you call that, diagnose it or go and see a doctor. Because lots of times people think it's like mengada aja, dramatic lah, doing some, why everyone else don't have that. So that's a very wrong way of looking at things
Mhm,
because everyone is different.
mhm. That's correct. So read up on it, get yourself, know the signs so that you guys can be better for each other, to watch out for each other.
Yes, yes, true. Okay. So any other questions?
No questions so far.
Wow,
That's
amazing.
Yeah.
Everyone is tired. Probably it's been 1 hour.
Everyone's like engrossed into this session right
This
here.
talk. Okay, so this is my last slide. Okay,
Hey guys, you
thank
need
you
to take
very much for
a
tuning in.
screenshot. You guys need to take a screenshot. Thank you so much, Dr. Navdeep. It is definitely an honor for me to have this talk with you and to host this talk with you. Wow, why did I choose Dr. Navdeep? Whoa, what a question.
Oh, okay.
Okay, so my husband and I had gone through. I think we were married for 4 years and we could not conceive. We went through different doctors. Um, I felt comfortable. Okay, I felt comfortable with Dr. Navdeep because he spoke to me like a person. I'm not sure if anybody's experienced this. Sometimes we go to doctors will talk to us like we don't know any bit better. I get scolded. Sometimes I went to another doctor, or one of the first few doctors I went to, I got scolded for not knowing the most basic things. I'm like, I just got married. Of course I don't know these things. That's why you're here to tell me. Dr. Nafi just said don't go Google, right? So there was no stupid question. There was no dumb question with Dr. Nafdeep. In fact, he wanted me to ask. And he was reassuring, and I think something that um, the reason why he became a fertility specialist, or rather, it's a personal journey, and that's something that having someone go through that, know the difficulties, and also that makes him be able to understand what I was going through, me and my husband was going through even more. um I mean, you guys have heard him speak tonight. The way he speaks, the words he chooses, the perspective that he gives us, he gave us, me and my husband, we just felt very comfortable. Um, that's why I decided to go back to him. I just felt very comfortable with him, and it was just a feeling, and I'm very glad that I went with that gut feeling, because my gut feeling was right. And I will always, like all of my friends who, like, I have a friend who is in Indonesia, and I tell her, you gotta come here, and you got to see Dr. Nafdeep. So she's just waiting for MCO to be lifted, and anyone I have around the world, all my friends, I tell them, you gotta come and see Dr. Nafdeep. Like, I trust him with my life. um, I trust him with my baby's life.
Yes.
Right, so that's a good question, and I was not expecting that question directed to me, so thank you, Amanda, for that.
Mm.
Yeah, so I think we've just hit the hour mark, our 5 minutes. So thank you guys. Is there anything else you want to say before we close, Doctor?
No, I'm done. But thank you very much for hosting this session with us today. It was definitely interesting questions. Okay, it was quite nice doing this.
Yes, it was a lot of fun. Hopefully, we'll have more to come. It's good interacting with you guys, Amanda, Mel. Who else was it? Sharon, who asked Stephen, Apen. So it was good to talk to you guys. Thank you so much for keeping us very entertained with very interesting questions. And I hope tonight was a valuable night for you guys. Thank you so much for tuning in. And with that, we shall bid you good night and stay safe and be kind to each other. Have a
Yes,
good night,
good night.
everyone.
Good night. Take care. Bye bye.
Bye.